I'd like to thank you all for coming. We have an important announcement today about a community partnership between our local criminal justice system and local mental health service providers to expand our existing mental health review team into a mental health pilot project that will create valuable new resources, including a new mental health court. But before we explain that program, I think it's appropriate to take a moment to acknowledge the passing of Dr. Mark Hickman, a psychologist at Centerstone who is manager of the Centerstone ACT team, which stands for Assertive Community Treatment. Dr. Hickman was also a member of our mental health review team. He attended monthly meetings in the prosecutor's office conference rooms to discuss cases. He's someone that we've all worked with for years in our justice system. He retired on Monday of last week and died on Friday, just a few days later. And we're all very sad and disturbed to hear that news. And I want to acknowledge Dr. Hickman's many contributions to Centerstone and to the community, and express our appreciation for his life work helping others in our community over the years. Indiana's new criminal code went into effect this past July. Sentencing changes in the new law have put increased pressure on local resources to provide treatment and rehabilitation programming for certain offenders through county probation and community corrections programs. The legislature intended the changes to improve public safety by encouraging greater use of evidence-based programs to reduce recidivism. Another goal was to control state prison spending at the Indiana Department of Corrections. Throughout the process, legislators have recognized the need to provide additional funding to help counties deal with the burden of expanding local services. However, so far that funding has been slow in coming. That means that counties have had to compete aggressively for the limited pilot project funding that's currently available. Thanks to an assertive partnership between the Monroe Circuit Court, probation, the prosecutor's office, community mental health provider Centerstone, and addictions recovery program Amethyst House, Monroe County has successfully obtained new funding that will help meet the challenges imposed under the new criminal code by enabling us to expand our existing resources in the area of mental health. The Monroe County Prosecutor's Office has long coordinated a mental health review team that meets monthly to discuss criminal cases where the defendant is identified with underlying behavioral problems due to serious and untreated mental illness. Those monthly meetings are scheduled and coordinated by our mental health Deputy Prosecutor Trish Bushy, who's here with us today. Trish, where are you? There she is. The team also includes clinicians from Centerstone, the Jail Diversion Coordinator, Dr. Don Weller, who's here with us today as well, probation officer, and a public defender. In appropriate cases, the team can recommend a mental health treatment plan to address the underlying behavioral issue for a particular criminal defendant. According to the Bureau of Justice Statistics, 56% of inmates in state prisons have a mental health issue. Compare that to 20% of the general population, according to SAMHSA, the Substance Abuse Mental Health Services Administration. Of those 56%, only 1 in 3 receive mental health treatment while they're incarcerated. Due to the closure of many state-run mental health facilities and cuts in funding for community mental health services, it's not unusual for people with serious and untreated mental health issues to engage in disruptive behavior and eventually wind up in the criminal justice system and incarcerated. Without adequate mental health services in the community to promote long-term stability, many of these people cycle repeatedly through periods of crisis and decompensation and wind up back in jail again, imposing further costs on taxpayers and undermining public safety. Our goal is to keep those people mentally stable and out of trouble, and not only to benefit those individuals, but to keep the community safer and save taxpayer dollars over the long term. Where mental health treatment can effectively address an underlying behavioral problem and we can effectively monitor compliance with such treatment, there are real benefits for both the individual and the long-term safety of the community. Since the new criminal code went into effect in July, some new funding opportunities have become available. Team members in our community have collaborated to aggressively pursue those new funding opportunities, and we've been successful. Since learning of our success in obtaining those funds, we've held a series of meetings to quickly plan the details and develop new resources to expand our mental health review team into a new mental health court. The mental health court will be overseen by Monroe Circuit Judge Ken Todd, and that court is scheduled to begin receiving referrals next week. Centerstone and Amethyst House each received funding to create new resources that will support this effort through a forensic diversion grant from the Indiana Judicial Center for a one-year pilot project. Centerstone received $83,201 that will be used to create a new recovery coach full-time position for this project, and also to fund a part-time clinician to serve as mental health counselor and program coordinator for this project. Amethyst House received $25,000 that will be used to expand their residential program for offenders with co-occurring mental health and addictions diagnoses. Amethyst House will also partner with the Indiana University Speech and Hearing Clinic to serve participants identified as having traumatic brain injury. There's an additional $11,799 that was provided for a customized computer software license to support these new services. Monroe County Probation also received funding that will enable it to support the new mental health court with increased services. Probation received an ongoing expansion of community corrections funding in the amount of $64,747 to pay for a full-time probation officer case manager position. Using that position for the mental health court, probation will help screen defendants for eligibility, expedite referrals to needed mental health treatment services, and monitor participants' compliance with court requirements. Working together, all these new resources will help participants to successfully comply with their mental health treatment plans, attend follow-up appointments, and take their prescribed medications. All of which we hope will help stabilize the mental health concerns faced by these individuals, preventing future crises from spiraling out of control. And like the successful Monroe County Drug Court program, we hope this new mental health court will improve community safety, reduce recidivism, and save taxpayer dollars over the long term. So we're excited about these new resources. We're glad for the opportunity to expand our partnership and work together more effectively to better serve the community. And now to further explain the concept of the mental health court, I invite Circuit Court Judge Ken Todd.